This is Cadillac Unscripted on 107.9 CDY. It's a half hour of local chat. Katy Huckle is here with me right now. And this is our quarterly chat with someone from Munson,
Yes.
Munson Healthcare Cadillac Hospital. And this is our first time that we haven't welcomed Dr. Jim Whelan to the show.
That's right.
Because for the first time in a couple of years, COVID isn't exactly at the top of the headlines, and isn't that nice?
Yes,
for a change?
we needed a little break. So
Yes.
we've got the president with us today of Cadillac Munson Hospital, Peter Marinoff. Welcome, Peter.
Thank you so much for having me on. I'll try to be as entertaining as Jim Whelan.
He raised the bar high, Peter.
Absolutely. Well, and I think what people are looking for, Peter, is information. You know, what should we be doing? That kind of thing. So we're interested to talk to you about how our beloved hospital is doing, how your staff is doing, and then what we should be doing in the community to be proactive.
Sure, yeah.
So
That sounds great.
okay, let's start with a brief COVID update, please. Could you tell us how things are going? How healthy is the community?
So, it's interesting. If you had asked me a couple months ago, I would have told you that we were probably considered a higher community infection rate in northern Michigan and other parts of the country. But right now we're actually in the green. So the community infection rate in northern Michigan, and this includes Wexford, Missaukee, so in all the counties north of us, we're just under 10% community infection rate. So we're doing quite well. Other parts of Michigan are running about 13%.
Excellent.
What was it at its peak, Peter?
Man, that's a really good question. I think we were actually in the 20s.
Mm-hmm.
We were running in the 20s there. What's been a little different this time around is the most recent community infection spike that we had. We were really fortunate in that it didn't lead to a lot of hospitalizations. So here in Cadillac Hospital, probably our highest number in the hospital was about anywhere from 6 to 8 beds occupied with COVID inpatient, whereas in other past peaks, we were reaching probably about 75% of our beds full of COVID inpatients. So this is, while you never want to see a high infection rate, it was great to see low hospitalization.
Do we attribute that to the thought that this particular variant wasn't as severe as previous ones?
A really good question. I'm not clinical in nature here,
Mm-hmm.
and it seems like the more we try to kind of peg COVID a certain area, we're kind of wrong. So I couldn't tell you if there was a nuance within the variant, but I just kind of go off the data that we saw here locally, but also across the state, that there weren't a high number of hospitalizations.
That's good. That means people simply weren't getting as sick as they were before.
Absolutely. In terms of the hospital itself, the structure, we all have friends that have some type of phobia about going into hospital. They don't like hospitals, or they don't like blood, or they don't like things like that. And then COVID hit and kind of changed the fact that you can't just go, even if you wanted to go to the hospital to see somebody, you had to check ahead and make sure that, there weren't going to be too many people there. Can you tell us how that kind of culturally has changed visitors to patients in the hospital?
That was actually probably one of the more painful things that I saw. And so actually when the pandemic started, I was actually in Paul Oliver Memorial Hospital in Frankfurt, and we had a long-term care there within the hospital. So we couldn't have visitors at all. And if you think of our elders in a long-term care or skilled nursing facility, visitors are, as essential for healing as anything else. And actually, it's just great for your mental well-being to have routine visitors. So it changed a lot in that we had to switch to virtual connections that way. But that interaction was impacted there. I think, here in the hospital, with the OB, just with our inpatient unit, we went from not being able to have visitors at all in the EDs, not being able to have visitors, to we've been able to loosen that up over time, and you could have 1 to 2 visitors depending on what the community infection rate was. We still do have large families that want to come in to visit loved ones. Mm-hmm. What those families have learned to do really is to just kind of have what we would call a rotation of visitors coming in and out of the hospital. So we've been able to get back to some kind of normalcy, but not really as restricted as we were before.
Thank you so much. So that means if someone you were close to was sick, you could, check in and find out when would be a good time for you to stop by so that you didn't step on somebody else's toes, that kind of thing.
Correct.
Okay.
Yes.
Thank you for that. Now I get it.
So it has been, about 27 months since everybody's lives changed forever. Mm-hmm. Patients, doctors, nurses, support people. I know you probably want to brag on your nurses and your doctors and your support staff in the Munson system, don't you?
I can't say enough about the team we have collectively across the system. But here in Cadillac, it's been really impressive, and to watch just the resiliency of the team, and just it's in a small community like Cadillac. Cadillac's pretty big, but we're small overall, and we have friends and neighbors and family members, and just how the team's been able to, I think, despite a lot of the challenges that COVID's brought about to our communities, to see how people have been able to continue to maintain a positive attitude, and to really help focus their attention on the healing of others, despite the challenges that they've faced. It is. I'm in awe every day when I come in, and you see the interactions of our team with patients, with their families. When you hear the stories from patients and families, and it's one thing to be able to help somebody heal, but it's another to connect with them on a deeper level. And the team here has been able to do that the whole time, and really put a lot of things on hold in their lives to help others. And so, I think despite the worst that the pandemic has been able to throw at us, people have been able to really rise above all of that and just continue to give the best to our friends and family.
That's powerful. Gave me the chills right there, Rich. I did have a visit that I did recently, Peter, and my friend was just telling me, I'm getting a little choked up, about your amazing nurses and just how they started, because the visitors were limited, how they started to become almost like family, remarkable.
It is. It really is kind of touching the connections that people have, and the bonds that you form. It's you really do kind of have an appreciation for the things that are around you, and despite the challenges, you really do take a look around and count your blessings. So mine definitely is being a part of this team. So
a shout out to all of your people over there at Munson.
Oh, for sure.
Mm-hmm. Speaking of being part of the team, Peter, you've been on the job now for about 6-8 months. How long have you been community president for Cadillac Munson?
2 years.
2 years.
So, I can tell you, there's probably easier times to slide into a president's position than during the middle of a pandemic. But I'll tell you, the 2 years has gone by pretty fast. And I have to tell you that the team here, and this includes not just people employed in the hospital, but also there's a really great base of independent physicians in the Cadillac community. They've been very supportive and super embracing of bringing new people into the fold. And then the community overall has been very embracing. A lot of leaders in the community reaching out and just kind of helping you feel like a part of the community really quickly. So that's been great. So more than 6 months, but it's been 2 years.
I think it's, the hospital is in many ways the center of the community. It's where all the healthcare goes on. It's where the healing happens. It's where, the passing on happens. There's just so many important things that happen in that building. So
it's an anchor. It's an anchor. And I will also tell you, Peter, that I've met with in my line of work, mortgage banking, folks that specifically move to communities for the hospital. And this is one of them. They want access to quality health care. They want walkability to parks, libraries, farmers markets. And the hospital fits into that. And it's come up frequently when I meet with folks that are moving from metropolitan areas north. They've checked you guys out and, thumbs up.
Well, thank you. I appreciate that. It is true that people do look to healthcare systems, kind of similar to looking to schools and other aspects of the community. Hospitals are interesting. They're like fingerprints of their community. So each hospital is kind of unique, but they're more of a reflection of the community around. And when I look in the Cadillac community, it's a very professional community. They expect high quality in everything that's done. And so you can see that reflected in the culture here, that it's a very professional culture, but also they're very down to earth and in tune with providing a personalized set of care too. So it's been a really good blend of what you want to see in healthcare, where it's very personalized, but also at the same time, you can really set your watch to the quality and the safety of the care provided here.
Your career journey brought you, Peter, to Cadillac. And by the way, this is Cadillac Unscripted. Peter Marinoff is our guest. He is the community president for Munson Healthcare Cadillac Hospital. You've been in Cadillac for 2 years. Tell us a little bit about your career journey leading up to you being here.
Sure. So, I've actually been with Munson Healthcare for over 20 years. And I started off in accounting and finance, and then got into operations, and started off at actually the smaller of the hospitals in the Munson system, which was Paul Oliver out in Frankfurt. And so over in Frankfurt, it's where I really fell in love with really rural healthcare. So opened up a couple physician offices in my time over there, expanded some of the operations within Paul Oliver, learned a lot with nursing home care over there, and just got to work across the state with other small hospitals, like in the UP and across the state, on collaborative projects in and around the state. And I think I've been in operations really with Paul Oliver. I'd been there for about 10 years, working on the operational side of things. And then again, most recently here in Cadillac, the last 2 years, working in a larger hospital that had more expanded services. But I was able to take some of the learning experiences from Paul Oliver, applying here in Cadillac. But it's a really amazing group here of leaders in Cadillac Hospital. So they've actually been able to teach me some things about working in a larger hospital and just it's actually been a great journey over the last 2 years of expanding the scope of, okay, here's what we're doing in Cadillac, and here's some opportunities, and just expanding from there.
When you talk about opening up physician offices in Frankfurt and in your team here in Cadillac, I know the hospital collectively says, "Oh no," when a doctor says they announce retirement, because our doctors see a lot of patients, as we know, and it feels like you folks are constantly recruiting. Would you say that's true, Peter?
We are, and you're always going to keep the door open to recruit people in, because if there's an opportunity to bring in a great physician to the community, you never want to shut the door on that.
Right.
And, you know, Cadillac's really had some phenomenal physicians over the years that, eventually they're going to retire. And we saw that in Frankfurt. I think every community sees that. In rural healthcare, it's even more critical, because if you think of the scope that a physician has, they can actually, I think what's expected of those community physicians is a little more. There's a little more expected of those community physicians than what you might find in a larger city. I'm not saying that there's not high expectations in larger cities, but I think rural just has a different feel, and you just need a more specialized approach to medicine in these communities. So we are always recruiting for all positions.
I would think, Peter, that makes it more challenging, though, to find the right fit in a community like this. Wouldn't you say?
It can be a challenge. I think probably some of the advantages we have here in Cadillac is, one, you have really strong provider groups. And again, these are not just employed through the hospital, but the independent provider groups. It is a very collaborative team of physicians in and around the community, and that really helps us to bring in physician recruits. So I'm not saying it's an easy job, but I think it's easier here than what you would find in other parts of the state or the country.
And Peter, I've spoken to physician friends of mine that called a buddy from college that they went to medical school with and said, have you ever seen Northern Michigan? You might want to check this out. And doctors have come along that way too. So in that case, it's takes a village type of mentality of, throw out your fishing line and then show them how beautiful Northern Michigan is. And some of those folks came and stayed.
It really is. And then you get to Cadillac, it's a little bit like a Goldilocks community, where it's not so small that, everybody knows everything about you. Mm-hmm. But it's not so large that you become one of the many. Mm-hmm. It really has a very unique feel to it, and there's plenty to do in and around Cadillac. So I think with those connections of people leveraging, when you can get them here to see the community, be a part of it, come into the hospital, and you can walk them through the hospital and say, okay, your hospital that partners with you for patients is ranked top 20 in the United States 2 years in a row for small rural hospitals. That kind of helps to provide some comfort to those physicians that might be coming here, that it's a high quality service we're providing in tandem with the physician partners. So having those connections really does help.
So you bring up an important point. That's an important number, top 20 rural community hospitals. What should we as community members be doing to promote Munson and Cadillac? How can we help to keep the organization as strong as it is, or even stronger? What should we be doing, Peter?
I think an important part of that is feedback.
Okay.
So if you come here and you have a great experience, we'd love to hear about what made it great. If you come here and maybe the experience didn't match the expectation you had, we would love to hear what was the gap there. And then that just helps us better understand the service delivery that we're doing. And, I think at the same time, letting people know, hey, have you checked out Cadillac Hospital if they're saying they're going somewhere else for a different service? If everybody has a reason why they may go somewhere, but if it's based on that they didn't know we had that service, we always encourage people to let them know that we have a full range of services here in Cadillac.
Okay, got it.
You do bring that up. That's very interesting, Peter, because, I have 4 kids, and I have, between those and myself and my wife, we've been frequenters of the emergency room for various reasons over the years. And every time you come to the emergency room, a few days later or a week later, you will get a questionnaire in the mail saying, how did we do? Mm-hmm. Don't throw it away.
Right.
Fill it out, send it back.
Absolutely. Well, when you have a baby, you get a phone call after you're home. How is it going? Mm-hmm. And answer that phone call and contribute feedback and information too.
And you'll even occasionally get a thank you note signed by the doctors and nurses for, thanks for trusting us. So, those are little things, mm-hmm. Peter, but they make a big difference.
They do, for sure. And again, they help us to understand, okay, this is what, I think nationally, certain things that people value, but locally you can find out what people really value and things that, okay, we're doing a really great job here. Here's how we can, further that, or here's an area that we can maybe take a look at again and possibly enhance. And it can be things as simple as lighting, wayfinding, furniture in a waiting room. It can be all sorts of things, but it's people providing us that feedback that just helps us to continue to just provide good service here.
Peter, we've had expansions to the hospital here in Cadillac. And so another question would be, is the hospital large enough to accommodate the patient load?
It depends on what time of day. No, I'm just joking.
Exactly.
I would say yes, we are large enough. I think one of the changes that we're seeing in healthcare and that we're actually trying to work on is how can we diffuse some of the volume coming into the hospital. So what I mean by that is how can we get some services outside of the hospital so people can get in and out quickly for services. So things like radiology or things like lab services, where they can come in and out. Our rehab services, they're in a building outside of the hospital. I think size-wise, Cadillac has a large enough base of inpatient beds. ED beds, it's a little hit or miss based on I think some seasonal volumes, but I think overall we have a pretty healthy amount of beds here. Certain services we're looking at expanding. So, for instance, CT services. Cadillac is going to have a second CT scanner brought online. So for many years, we've only had one CT scanner here in the hospital. This winter, we'll add a second CT scanner, with enhanced capabilities as well. But we'll just have that secondary option. And what that will help us to do is to kind of reduce a backlog of patients and be able to get more patients through and get them kind of results quicker. So, I think in some ways, yes, we have enough space and enough capacity to handle the load in the community, but there are some areas that we're seeing we need to expand a little bit, just so we don't have people having to wait to get service.
Thank you. Excellent. That's exactly what I wanted to know about, is how are we doing? And it sounds like we're doing well and identifying where the organization needs to grow. Wonderful.
All right. I think that brings us to a close here. We're almost at 30 minutes. So, Peter, first of all, after 2 years, it's finally nice to talk to you and welcome you to Cadillac, even though you're a veteran at this point. And
a seasoned leader. And after 2 years of what you've endured and your team has endured, thank you so much for not tiring and tuckering out on us, because we needed this amazing group of, like you said, caretakers and healers. Thank you.
And thank both of you for having me on. So it's been great. I wish we could do this in person. So maybe we could do it again in person, and maybe we could have Jim Whalen, the rock star, there with me too.
Perfect. Dream team. We'll call that the dream team right there.
In a few months, we're not going to talk about when the weather is colder, but in a few months, we'll get together again, the four of us, and have another Munson focus show here on Cadillac Unscripted. Peter, thank you very much.
Rich, Katy, I appreciate it. Thank you guys so much.
Peter Marinoff, Community President of Munson Healthcare Cadillac Hospital, our guest today. Join us next week. More local talk, same time, same station, Cadillac Unscripted, sponsored by Independent Bank on 107.9 CDY.